Hi, my name is Lori Jenkins, N150. This is my rubric for wound packing and irrigation. All right, so first I'm going to perform hand hygiene. Obviously going to introduce myself. Hi Teddy, my name is Lori Jenkins. I'm going to be your nurse today. We're going to take care of your wound, take a look at it, clean it, and repack it and seal it. Is that okay with you? All right, I'm going to do 2 identifiers. May I check your wristband? Can you please tell me your name and date of birth? Teddy, 1150. Great. I'm going to take a look at the mark here. And just make sure my patient isn't having any pain at this point before we go ahead and start any procedures with taking the wound preparation away. Teddy, are you in any pain? He indicates no pain, so no medications would be dispersed at this moment. If he would indicate a lot of pain, we would check the medication administration record to see if he could have some medication, and then check back with him in 30 to 45 minutes before changing the wound. So I'm going to don gloves here. And this is just for removal of the bandaging, and this is not a sterile procedure at this point. For skin and tissue integrity, I'm just going to peel back the bandaging and tape here. How you doing, Teddy? Making sure my patient is okay. Taking it very slowly so not to rip the skin as it is already fragile. Take that away. Drop that into the trash. Actually, I'm going to pretend as if I still have his wound care because I want to take a look at the drainage from the wound. I want to take a look and see what kind of drainage is there, whether it's sanguineous, serosanguineous, purulent. The wound seems to be healing just fine, but we're going to further assess that here in a moment. Now I will discard his wound here. All right. So now here we are going to unpack and measure. Teddy doesn't have any packing here in the wound, so we are going to go ahead first and measure this. Measuring tape, I'm going to measure in centimeters from 12 o'clock to 6 o'clock. It appears to be 5 centimeters, and from 3 o'clock to 9 o'clock, another 5 centimeters. So I'm just going to make sure I document that. At this point, also, we're going to go ahead and take a swab of this wound. Also going to put name and date on the specimen to ensure the validity of the test. So now I'm going to irrigate and assess the wound. Before doing that here, we're going to put Mr. Teddy, to catch any drainage that comes off, and we're also going to put him in a sideline position that way as to irrigate the wound from the best looking part down to the the most slough, which is right here at the bottom. You see the most slough right here. Okay. I would have like an emesis basin or something here to actually catch some more of the drainage from the wound. So I'm going to pretend that that is there, and I'm just going to pat dry anything left over. Okay. So I'm going to take these gloves off here, as now we're going to begin the sterile field preparation. So I'm going to attempt to work in order here so that I don't cross the sterile field barrier. Being very careful so as not to touch the inner layer of the sterile field on the inside of the packaging. And here now I'm going to prepare to don my sterile gloves. Right, I've got my right sterile glove donned, and before I put on my left, I'm going to go ahead here and get my alginate dressing and my sterile water. Down. So now that the wound is cleaned, it's irrigated, we've taken a look at it, taken a look at the tunneling that is there. There's one tunnel that we're going to fill here during the sterile procedure, and the rest we will cover date and label. So. Obviously, that would go in deeper into the tunnel, and we would just leave a little tail hanging out. That way the next person who packs the dressing knows it's still there. The last thing we're going to do here is to tape it down. At this point, the sterile procedure is done because the wound is covered. So the sterility of the procedure is not necessarily so much as important as it was when the wound was open. Lastly, I'm going to initial date and time and affix this to his wound care. That way nursing care, healthcare knows when it needs to be changed again. At this point, I would just document all the findings I had during his wound care. I would document coca, the color, the odor, the consistency, the amount of the wound. I would take a look at the depth, the height and width of the wound. If there was any pain or any pain medication assessed to the patient, I would also assess any findings in regards to any wound healing or decline in the wound health. And that would be it. The last thing I would do, obviously, would be to perform hand hygiene. I would restore, replace, and report my findings. Like I said, document, put him back into a nice, healthy, and comfortable position according to the physician's orders. That's it.